Most older people have conditions like diabetes, hypertension, heart disease, kidney problems. That is common to every old person. So there are 5 I's in geriatric medicine, which would be instability, immobility, impaired memory, incontinence, and iatrogenic. Instability is a common problem that we see in older people, and we take every measure that they don't sustain a fall. Loneliness kills people much more than heart disease, strokes, and other problems. So loneliness is a big killer.
Welcome Dr. Manoj C. Jacob, Head of Geriatric Medicine Department in Sunrise Hospital, Kakinad, Kochi. He is a trained geriatric physician. Welcome, sir.
Thank you.
Sir, what is geriatric care?
Yeah, that's a very good question. Many people are not aware of this term geriatric. Everyone knows about pediatrics, but geriatrics is something that people are not familiar with. Geriatric medicine, geriatrics basically is actually care of the older population, the older persons, which in our country we would take it as 60, while in the Western world we would take 65 as a cutoff. So anybody above 60 or 65 is considered a geriatric population,
Okay,
and care of their specific needs are actually comes under
Geriatric.
geriatric care.
Okay, sir. What are the common medical conditions and challenges that older people face, and how do you address them?
Most older people have conditions like diabetes, hypertension, heart disease, kidney problems. That is common to every old person. But in addition to these common problems, there are also specific areas that we commonly see in people who are old. In our terminology, we use the term geriatric giants. Giants means big problems. So there are 5 I's in geriatric medicine, which would be instability, immobility, impaired memory, incontinence, and iatrogenic. I'll explain these 5 terms in a very simple way.
Okay.
Instability means most older people, they become unstable and they have a likelihood of falling. And once they fall, they are likely to sustain a fracture because their bones are weak. And when they sustain a fracture, they become bedridden, and they have a very difficult time. So instability is a common problem that we see in older people, and we take every measure that they don't sustain a fall. The second thing is immobility. Many of them, due to various reasons, become immobile. Immobile means they are unable to move. They become bedbound. And when a person becomes bedbound, there are common problems associated with that. They sometimes are unable to pass urine. They develop bed sores on their beds and multiple other problems. So that is the second problem that we see in older people. The third problem, what we see commonly, is impaired memory or impaired cognitive function. That is, as people grow older, due to various reasons, either age-related or conditions like dementia, they lose memory, or they have a progressive loss of memory. So what happens? They are unable to remember people. They are unable to do their normal functions like banking, shopping, cash transactions. People can exploit them, people can cheat them. They cannot cross a road. They are likely to fall. They are likely to lose their way when they go to the bank. So this is a very common problem that we see in older people. That is what we call impaired cognition or impaired memory. The fourth problem that we commonly see is incontinence or leaking of urine. As people grow older, sometimes they lose control of their urine passing. So what happens? They start leaking urine, and so they feel very embarrassed to go to a public place because they feel that people might smell the urine. So they avoid going to public places. They avoid going to marriages. They avoid going to birthday parties, and they become socially isolated. And when they become socially isolated, they can become depressed, and that can have its own problems. So that is the fourth problem that we commonly see. And the last problem is what we call iatrogenic. Iatrogenic means treatment induced. Most of these old people are under treatment from various specialists, cardiologists, neurologists, nephrologists, urologists, various people are treating them. So each of them will have their own medicines that they prescribe. these medicines can cross interact with each other and produce complications. So that is what we call iatrogenic. So just to revise, 5 I's: instability, immobility, impaired cognition or memory, incontinence, and iatrogenic. And last problem that I like to highlight is also what we see commonly is loneliness. Many of these older people are staying alone, especially one of the spouse dies, is no more, they are very lonely. And yesterday I read in the papers that loneliness kills people much more than heart disease, strokes, and other problems. So loneliness is a big killer, and it is a common problem that we see in older people. They become depressed, they become isolated, and there is a high incidence of cancers, high incidence of heart problems, high incidence of brain problems, strokes, because of loneliness, and also dementia. They say that people who are lonely are much more likely to have dementia.
Sir, what made you choose geriatric care?
I have a personal story behind this decision to take up geriatric care. I'm a trained physician. I took care of people who are acutely sick, managing the ICUs. But one incident changed my whole perspective to older people. My father, who was a very strong man, developed Parkinson's, and he became bedridden. He lost his memory. He became totally bedbound. He could not feed himself. He had to be fed through a tube. And I had the privilege of taking care of him for almost 5 years. I means me and my family as my wife and my children. So that really helped me to understand the actual need that is there in society in caring for older people. Because they have given us so much in life that it's only reasonable that we at least give them a small portion of what they have offered to us. And we are here today, or we are what we are today because of what they have sacrificed for us. So in that case, it's only logical, reasonable that we gave back something to them.
Yes.
So having cared for him, I understood that in society, families and caregivers are not able to, are not equipped or to address the problems that they face in caring for their dear ones. So I thought, why not devote my life for this? And that's how I trained myself in geriatric medicine from CMC Vellore, and then started working in geriatrics. And it's been an exciting journey for the last 5-6 years.
Okay, sir. Nowadays, so many of them are going abroad, and India is now becoming an old age home. So, what are the possibilities here in India and abroad?
See, as you know, all over the world, people are aging. Health care is improving, medical facilities are improving, people are living longer. Earlier, people who used to live up to 60, 65, now there are people living up to 80, 85, 90, If you look at India's population, in 2022, we had 14.9 crores of older people above 60, which is about 10% of the total population of India. And it is estimated that by 2050, India will have 34.7 crores, which will be 20.8% of the population. So you can imagine 20.8% of the population of India will be old by 2050. Same thing in Kerala. In Kerala, they say in the last 60 years, the percentage of older people has increased from 5.1% to 16.5% today. That means Kerala's population as of the 2018 census is 3.5 crores. Yeah. So 50 lakh older people are there in Kerala. Same thing all across the world. Look at the world's population. They say that in 2022, 77.1 crores, which is 771 million people are there who are above 65 years of age. And it is estimated that it is increasingly growing very rapidly, and by 2050, 16% of the world's population will be older people or geriatrics. So, the needs are going to be tremendous, the care needs, and most families are now nuclear families. Children go abroad, settle down, there's no one to care for older people. So, there is an increasing need that is projected, in care of the older people.
Sir, what are the other possibilities or scope in this field?
See, the whole world is aging, and everybody, those of us who are young today and are going to get old tomorrow. So this is going to be an ongoing process of people getting old, and the older population is only going to increase. So, there is no dearth of opportunities, in terms of, getting jobs or, career growth in this sector, which is the care of the elderly people. But as I said, in addition to career growth, we also need to develop a passion to take care of all those older people. So in addition to career growth and the opportunities available all across the world, we also are able to enjoy what we are doing.
Sir, what are the facilities available at Sunrise Hospital in geriatric care?
Yeah, 2021 is when I was enabled to start this department in Sunrise Hospital. We have an outpatient which functions on Mondays, Wednesdays and Fridays. We do a comprehensive assessment of people who are old, because it's not just enough to treat the problem or to control the diabetes. We have to look at their memory, we have to look at their risk of falling, we have to look at their sleep. Are they constipated? Are they passing the bowels normally? Are they depressed? Are they anxious? There are multiple areas that are they leaking urine? Can they hear properly? Can they see properly? Because if you can't hear or see properly, you are likely to fall. And in that case, you can have a fracture. So, we do a comprehensive assessment of these people, and then depending on which are their problems, we address the problems. And sometimes they might need a specialist consultation, like they need to see a cardiologist or a neurologist. We would refer them to the concerned specialty. So I would always advise older people not to directly go to a specialist as far as possible, because a geriatric physician can do a complete assessment and then refer you to the concerned specialty. That's what we do as outpatient. We also admit patients who need acute care. People who would have a pneumonia or have a problem, they have brought to hospital, we admit them and treat them and send them back to their home as early as possible. And most important, we also do home care. I have a small team of nurses and people. We go to the homes of these older people, because it's not practical to bring them to hospital every time. So we go to their homes, see them and address most of their problems at home. And only when it is absolutely necessary, we bring them to hospital and treat them. So these are the various things that we do now, and we are hoping to expand our services in the coming years.
Okay.
Yeah.
Okay. Thank you, sir, for spending your valuable time with us.
Yeah,
Yes.
I'm glad that you were able to bring this up, this need, and as you know, many young people are going abroad now, because there are a lot of opportunities. There is money, there is a lot of things, but also to realize that it's also a very difficult job. You need commitment to take care of older people. It's not easy. You need a lot of patience. You need a lot of love, compassion when you take care of older people. So even as you think of going abroad, don't look at just the career and the money making part.
Yes.
Look at go into this sector with a heart of commitment, with a heart of paying back to the older people what they have contributed to us, so that in addition to your career growth, you also are contributing to society and making a difference in the lives of these older people. And I would encourage some of you to even stay back in India, because we need committed people to take care of older people in India also, in Kerala, because they say that many homes will be empty in the next few years because there are no young people. So who will take care of these older people? If all the young people migrate and go abroad, there are no young people to take care of them. So I want some of you to even think of that need. And I'm sure it's a challenging but a very fulfilling area that you can get into. Thank you so much.
Thank you, sir. Thank you.